The heart houses the Shen, or the consciousness. We talked about this last week briefly, but again. So during the daytime, the consciousness will come out of the heart and come into the brain and animate the brain. And that's when we're being present. This is our ability to stay present. Not to digest the food, which is the intellect, but our ability to stay present. The consciousness relies specifically on heart blood. Talked about that last week. Relies specifically on heart blood, and hence heart yin, because yin is a component of blood. At nighttime, what does the heart do? Tries to settle down and come back. Sorry, not the heart. What does the Shen, or the consciousness, do? Tries to settle down and go back into the heart. If it can't go back into the heart, then you have insomnia. You have difficulty falling asleep or staying asleep. So since the Shen, or the consciousness, relies on blood, if the blood of the heart isn't very strong, then it's like there's not a comfy bed for it to come lay on. So you have a hard time settling down. Falling asleep, it takes a really long time. For heart yin deficiency, what will happen is they will fall asleep, not typically a problem, but then in the middle of the night, which is the most yin time, the yin's not enough. And they'll wake up. They'll have very vivid dreams. And that's because when you're yin deficient, you run hot, and that heat will agitate the consciousness. And then the consciousness will like to pop out of the heart. So you have these very vivid dreams. They're anxious, right? And then you wake up and you have a hard time falling back asleep. That's heart yin deficiency. The other big thing that it does, of course, which is the same as in Western medicine, is it commands the blood flow. The commander of blood. Right? It circulates blood. Straightforward. Pumping. Moving.